Hello, I am Angel Russell, Senior Director of Partnerships and Health Equity at the Colorectal Cancer Alliance. I am joined by gastroenterologists from Kaiser Permanente, Dr. Zhao and Dr. Malik. March is Colorectal Cancer Awareness Month, and today we are so excited to discuss ways to lower your risk of developing colorectal cancer and the importance of regular screenings. Dr. Zhao, do you mind introducing yourself?
Hi, everyone. My name is Alexander Zhao. I'm a board-certified gastroenterologist with Kaiser Permanente. I'm based out of the Falls Church office in Northern Virginia.
Welcome, Dr. Zhao. Dr. Malik, would you please introduce yourself?
Hi, everyone. I am Dr. Nita Malik. I'm a board-certified gastroenterologist practicing at Kaiser Permanente in Northern Virginia. I'm so excited to be part of this panel and just share some of our thoughts on the life-saving topic of colorectal cancer screening.
Thank you so much, Dr. Malik. Thank you both for being here today. So let's jump right in. Dr. Zhao, please tell us about colorectal cancer. What is it and how many people are diagnosed every year?
So colorectal cancer includes cancers of the colon and the rectum. Together, these two make the large intestines. This is part of the long gastrointestinal tract that starts from the mouth and ends in the anus. And the colorectal area is pretty much the last 5 feet of this gastrointestinal tract. So this is where food waste is processed, water is reabsorbed, and your stool is made. So cancers typically start as polyps. These are just small abnormal clumps of abnormal cells on the lining of the colon. All cancers typically start from polyps, but not all polyps will turn into cancers. As these polyps grow, they can transform into cancers, and these cancers can invade the lining of the colon, eventually can invade into small blood vessels, into lymph nodes, and then outside of the colon as they become more advanced. So in 2024, the American Cancer Society is predicting a little over 150,000 people will be diagnosed with colorectal cancer in the United States. The majority of these will be over the age of 65. However, 1/5 of these patients who will get colon cancer will be under the age of 50. So currently, it's the second most common killer in terms of cancers when you aggregate both men and women, but it is the #1 cancer killer in men under 50 and the #2 killer in cancers for women under 50 right after breast cancer.
Wow, that is significant.
Yeah.
Dr. Malik, do you know why people under 50 are being diagnosed with colorectal cancer at higher rates in recent decades?
This is a really important point. An increase in age is a risk factor for colon cancer, but there's sort of a global trend we're seeing towards this early onset colorectal cancer, meaning a diagnosis under the age of 50. The reason for this is really multifactorial. There are genetic influences as well as environmental and lifestyle exposures. When I say genetics, I'm really talking about those with a hereditary colon cancer syndrome or a first-degree relative with colorectal cancer. But the other risk factors, the environmental and lifestyle exposures, those are really linked to the overall rise in metabolic dysfunction we're seeing, the dysregulation, obesity, metabolic syndrome, fatty liver disease, sedentary behavior, red meat intake, heavy alcohol intake. Dr. Zhao quickly said this, but this uptake in cases under 50 has really prompted a change in how we view screening guidelines, and some of those have changed in the recent past. And now average risk individuals, that start of screening is now changed from the age of 50 to now the age of 45 because of some of these changes we're seeing.
Wow. And just off topic, not off topic, but off script a little bit, you said there are genetics that are at play here. Are there any genetic tests that can be done to see if you are at higher risk for colorectal cancer?
We don't typically recommend these in our average risk individuals, but those with a very strong family history of colon cancer or a number other of cancers should absolutely talk to their primary care physician about that. There are some genetic tests that can be done, but it's important to speak to your primary care physician first so they can do an initial screening about what type of family history you have.
Wonderful. Family history is so important when it comes to colorectal cancer. Dr. Zhao, what are some common symptoms of colorectal cancer?
That's a great question that a lot of patients come to see me for. In a lot of early cases of colon cancer, there are no symptoms. Certainly, as colon cancer has become larger or more advanced, there are some symptoms that we do have our patients make sure they speak to a doctor if they're experiencing. So common ones would be persistent bowel changes. So sudden onset of constipation or diarrhea that's persistent, that won't go away. Changes in stool caliber, so suddenly having pencil thin stools, very thin stools could be a sign. Unexplained weight loss, blood in stool or rectal bleeding, incomplete bowel emptying, so feeling like you just can't really finish your bowel movements. Abdominal discomfort that's new, that's unexplained. Or weakness or fatigue. And then a very common one also is iron deficiency anemia.
Wow. I know a lot of people sometimes experience those things and kind of pass them off as something else. So it's really important to know what those symptoms are and talk to your physician as soon as you experience any new or concerning symptom.
Yeah, absolutely. And as you said, a lot of these symptoms do cross over into other diseases that are benign, such as irritable bowel syndrome or inflammatory bowel disease, which is not necessarily cancer, but actually is a cancer risk. So it is really important to not ignore your symptoms. If you experience these things, don't keep it to yourself, talk to your doctor. That's what we're here for.
And especially if you are younger, because we hear so many times that, younger people will go into the doctor with, experiencing those types of symptoms. And then they're told, oh, you're too young for colon cancer, so it's not that. And then they explain it away. So it's really important for everyone to be empowered with the information that they need. And then perhaps even maybe go to another doctor if the one that you're with is not believing your symptoms.
Yeah, absolutely. Knowledge is power, and you can use that knowledge to advocate for yourself.
Absolutely. Dr. Malik, is colorectal cancer something that can be prevented?
Absolutely. There's a large number of factors that have been reported to be associated with a decreased risk of colon cancer. Some of those are regular physical activity and a variety of dietary factors, like a diet high in fiber. But on the flip side of that, there's also a large number of clinical, environmental, and lifestyle factors that are associated with an increased risk, some of which I touched on earlier, but obesity, diabetes, insulin resistant, consumption of red or processed meats, tobacco use, alcohol use, all of those are associated with an increased risk of colon cancer. So patients should be counseled about those associations and, of course, encouraged to reduce or avoid those factors, because that's really how we can prevent colon cancer.
Absolutely. Thank you for that. Dr. Zhao, how do doctors screen for colorectal cancer? I know we talked a little bit about genetic screening and the indications for that, but when do those screenings typically begin once they do start screening?
Yeah, so for, I always risk stratify my patients. So for your average risk person, this is a person you have no known family history of colon cancer or colon polyps. Currently, we are recommending to start colon cancer screening at the age of 45. And this was actually a recent decrease over the last several years. Before it was 50, but because of this increase of young cancers under the age of 50, this prompted multiple societies to adopt the new guidelines of 45. So some patients aren't even aware of 45. So that's the first thing to know, that 45 is new 50. And then, so for these average individuals, you actually have several colon cancer screening options that you can choose from. I'll just briefly go over the two tier 1 options. So one is FIT testing, which is just fecal immunochemical test. This is actually a home screening option. So typically a kit gets sent to your home. You take a stool sample from the bathroom, from the toilet, put it into the kit, send it back to a lab. And basically the laboratory is just testing for microscopic evidence of blood in your stool. The theory is large polyps or colon cancers have very fragile blood vessels. So as stool passes past them, we get this microscopic shedding of blood that can be detected by this test. If it's negative, then it's unlikely you have a colon cancer, but if it's positive, then you would get a colonoscopy. So pros of FIT testing: it's easily accessible. We can send it to your home. You can do it from home. You don't really have to take a day off from work. It's very easy and very private. And this is, if you do this modality of screening, this is an annual test. So you would do it every year. Then there's colonoscopy, which a lot of people know about. And this is considered a colon cancer screening option, a very good one. This is basically a long flexible tube. It's a little over 5 feet long, which is about the length of your colon, with a camera at the tip. We insert this colonoscope via the rectum, and we can do direct visualization of your whole colon. The pros of this is, if we see a cancer, we can see it, we can biopsy it. There also is a preventative component to this procedure, in that if we see polyps, we can remove those polyps as well. So we can prevent the progression of these polyps into cancer. So again, this is not only a screening, but also a preventative test. Downsides of the procedure: it takes about 30 minutes, a little longer. You do have to do a preparation process, which I think Dr. Malik will talk a little bit about, but it does require you to take some medications, either through liquid or pill form, to clear your bowels the day beforehand. For many cases, this is a sedated procedure, so it does require some sort of sedation or anesthesia. So there are risks with that. So there are kind of some more procedural risks involved for both on the anesthesia and the procedure side. But again, very good test. If you do have a normal colonoscopy, typically we offer this test every 10 years for average risk. Now, if you're high risk, these are patients who have family history of colon cancer, typically within first-degree relatives, or family history of advanced colon polyps, so many colon polyps or colon polyps that have concerning pathology. We actually recommend even earlier screening. So you should start at the age of 40 or 10 years before the age of the earliest relative affected. So if you have, say, your father was diagnosed with colon cancer at the age of 40, we would actually recommend your first colonoscopy at the age of 30. So in these high-risk individuals, we don't even recommend FIT testing. Really, FIT testing is good for average risk. If you're high risk, you should get a colonoscopy. There are some tier 2 options that I'll just briefly touch upon. These are really for patients who either are opting out of conventional colonoscopy or FIT testing, or have medical contraindications to get any of these procedures. So one is Cologuard, or multi-target stool DNA. So it's kind of similar to FIT testing, but it has an extra component where it tests for DNA, high-risk DNA changes in the stool. So that's Cologuard, and that's every 3 years. And then there's also a virtual colonography, or CT colonography, which is basically a CT scan version of a colonoscopy. And we have all these available within Kaiser Permanente and also most insurances. So really talk to your doctor, if you have concerns or you have certain preferences, talk about the different modalities.
I love that. There's so many great options out there, but you truly do have to find the one that works best for you. And talking with your doctor is the best way to do that, for sure. Dr. Malik, when people hear the word colonoscopy, and I know I have this reaction too, they think of the unpleasant prep process. How can patients make prep a bit easier?
Yeah, unfortunately, colonoscopy preparations get a little bit of a bad rep, but there are several things patients can do to just make it a little bit easier, a little bit more palatable. Things like flavor packets are really helpful for a lot of patients. Things like mixing Crystal Light in, or even lighter colored Gatorade is helpful. Just makes it a little bit tastier. Chilling the solution, drinking through a straw, and shaking it adequately are other things that can be helpful. Be sure to talk to your doctor because there are alternatives to the big gallon preparation that are a little bit smaller in volume, or even an alternative that solely consists of taking several tablets. Now, these aren't for everybody, so it's important that you talk to your doctor before thinking about some of those.
Awesome.
And I have to say, I did my colonoscopy this year, and that preparation was eye-opening for me. So I have nothing but the utmost sympathy for my patients. And I did a lot of the things you were supposed to do. It was still really rough, but you know, you have our sympathy for the preparation.
So you just had to power through it, right?
You know, I think it's important to know, I think the things that Dr. Malik talked about, you know, I think that some major issues are some people do get nauseous very easily and they know that they cannot handle large amounts of liquid. And that's an important thing to bring up to your doctor because there are low volume preps, there are pill preps, and so they can be also tailored to kind of what your preferences or your needs are. Because really you do need to complete as much of the prep as possible to have a good quality prep. If you can't finish it, then, you know, a lot of times the procedure may need to be rescheduled. So it's important to be able to tolerate it.
I was going to ask you, I'm sorry, go ahead, please.
No, all I was going to say, this is something that you want to get right on the first time rather than trying to fix the mistake later on.
Absolutely.
Right, because we've heard so many times about people doing incomplete preps and then the doctor doing the scope can't see as well as he should. And so there may be some things that are missed. Have you ever experienced that as well?
Yeah, I mean, we unfortunately do encounter poorer preps than others. And, you know, I think all of us have a tendency then to say that those patients have to come back because we can't adequately see the lining of the colon. Smaller polyps or sort of flatter lesions could be missed. So in those cases, we have to bring them back. That's the best thing to do for the patient.
That is so important. So important. Dr. Malik, I'm sorry, Dr. Zhao, actually, I want to ask you this question. Why are screenings so important? We're here talking about colorectal cancer screening. We're talking about trying to prevent colorectal cancer. When we're thinking about that, what makes screening so important, especially today?
Yeah, so I mean, this applies not only for colorectal cancer, this is breast cancer, prostate cancer, so many different cancers. But the reason why we recommend screening is actually because it saves lives. That's the most important thing. I think I saw one study that quoted that 68% of deaths from colorectal cancer could have been prevented by age-appropriate screening. So this is a preventable cancer. Colon cancer, when detected early, is a very curable disease. So we're talking about 90% survival rates over 5 years if you are caught early. But that survival rate will fall precipitously as this becomes more advanced. So if you're diagnosed at a more advanced stage, like stage 4, now we're only seeing survival rates at around 14%. So you're going from 90% all the way down to 14%, maybe because you waited a couple of years, 5 years. So, you know, screening early really makes a difference and it saves lives.
I love that. Personally, my best friend passed away from colorectal cancer at the age of 33. And she had been exhibiting symptoms for 10 years at that point, but her physician kept passing it off as, you know, diet related. What she didn't know was that she had a first-degree relative die of colon cancer, but she didn't find out about that until after it was already too late. And so it's really, really important to know your risk factors, to know if you have family history, so you know when the right time is to get a screening. Really important, could have saved her life.
Yeah, yeah. I mean, absolutely. I think, you know, that this goes upon it also having a doctor you trust, having someone that will take you seriously, knowing how to advocate for yourself, really important, and then knowing kind of how to ask the right questions as well.
Yeah, and people have white coat syndrome. You know, there's mistrust just generally in the medical system, but you said it yourself, being empowered, knowing what to ask and knowing who to ask, and knowing that maybe sometimes you need to ask someone else
Yeah.
to get the right answer. Yeah.
Absolutely.
Really important. We had a comment come in from Facebook about PrEP. So we'll just go back there just really quickly. But the comment said, don't be afraid of PrEP. It's much better than having to go through surgery, radiation, and chemo if cancer is found. So that's such a great point.
So true.
Absolutely. So, Dr. Malik, what are some other risk factors for colorectal cancer, and are there certain populations that are at higher risk?
Yeah, there are a few populations that are at a little bit of a higher risk. Those with a family history of a hereditary colon cancer syndrome, something called Lynch syndrome. Those with a personal or a family history of colon cancer, or even precancerous polyps called tubular adenomas, or those with inflammatory bowel disease, things like Crohn's disease or ulcerative colitis. Outside of that, there are certain populations in the US that are at a little bit higher risk. We see that Black Americans, Native Americans, as well as Alaskan Natives have some of the highest incidence and mortality here in the US out of all racial and ethnic groups. The reasons behind that are a little bit unclear. It could be just related to the higher prevalence of risk factors in these populations, but it could also be related to just the lower access rates to screenings in these populations as well.
Mhm. And we were hearing also that people in rural populations may be at higher risk, as you said, because of the lack of access to medical treatment and medical interventions as well.
Absolutely.
Yeah. Dr. Zhao, what diet and exercise modifications do you recommend for people looking to lower their colorectal cancer risk?
So great question. And I think we did another Facebook Live previously about gut health and diet. So this is really one of the biggest kind of modifiable things you can do in terms of risk factors for colorectal cancer. So things that I tell my patients, first of all, I think maintaining a healthy weight is really important. We do know that being overweight or obesity or having excess fatty tissue in your body is an increased risk factor for colorectal cancer. And so that also includes having regular activity or exercise. Sedentary lifestyle is also an increased risk factor. In terms of diet, I think Dr. Malik touched upon some of this. So really your high fiber foods, your fresh vegetables, your fresh fruit, whole grains, those are considered healthy for your gut, protective, and can decrease your risk for colorectal cancer. Some of the foods that you may want to consider avoiding in excess, fatty foods, red meats, these include your beef, your pork, your lamb. Those are considered possibly carcinogenic and to humans, and so maybe an increased risk factor. The ones that I absolutely tell my patients to avoid are the processed meats. So these are meats that are prepared either by smoking or by salting or curing. I'm sorry to tell this to our listeners, these are a lot of the delicious foods that we are used to. So cold cuts, hot dogs, sausages, beef jerky, pepperoni, bacon, ham. And then finally, sugary drinks. A lot of the sodas or very high fructose drinks, those have been associated with increased risk for a lot of gastrointestinal cancers as well.
It seems like a lot of what you could do to lower your colorectal cancer risk would also lower your risk for other diseases as well. We hear kind of some of those same things for other disease states.
Absolutely. Metabolic disease is a huge thing that's affecting Americans right now. I mean, this is why these new GLP medications are so exciting, right? Because people are losing weight. And it can treat a lot of different things, including fatty liver disease and cardiovascular disease and diabetes, which are big killers of Americans as well. But people forget that obesity also causes cancer.
Absolutely. It's such a risk factor, huge risk factor for so many other diseases. Absolutely. Dr. Malik, why is it important to moderate alcohol intake, and how does it improve your gut digestive health?
So in the context of colorectal cancer, it is very important to moderate alcohol intake. And really that's because it increases your risk of colon cancer. It's been observed in multiple studies. But it's important to note that's with moderate or heavy drinking. What that means is greater than 2 drinks a day. And that may be related to how your body is actually absorbing folic acid and how alcohol affects that. But aside from the cancer risk, it's important to cut back on alcohol because it can affect your gut in other ways. It can increase things like acid reflux. It can increase the inflammation in your stomach lining, and it can even cause sort of a misbalance in your gut microbiome. So overall, it's very, very important to decrease your alcohol.
When it comes to gut and digestive health, people now are just saying, oh, go take a kombucha or pop a probiotic and you should be okay. But then they follow it up with, alcohol or other, smoked meats. It's so funny. While we were just on this call today, a neighbor of mine just chimed in and said that they were smoking some meats for tonight. So
Totally.
very
I mean,
timely.
yeah, it's tough. I always tell my patients, there you can have cheat days. Certainly it's on a spectrum. So you are going to have maybe some of these things. Maybe you'll have a hamburger once in a while, but I think a lot of it is just, again, knowing everything in moderation. You want to not do anything in excess, but sometimes if you say you can never have this, you'll never can drink, you're not going to get a lot of people following those recommendations either.
Right. No,
Totally.
it's all about what you can add to your
Exactly.
diet, add to your regular day that could help put you in the right direction as opposed to being so restrictive, because we know that may not be.
Absolutely.
Yeah, you have to have a balance of everything. You can't just add on a probiotic to the, to the
Right.
salon weekends.
It's like, it's okay as long as we put a digestive enzyme on the top of it. It's fine.
No.
If only it were that simple, right?
I know.
Oh man. Okay, Dr. Zhao, smoking. How does smoking increase a person's risk for colorectal cancer?
Yeah. I don't think there's a doctor you're going to talk to who's not going to say you should quit smoking if you do smoke. So, smoking is probably one of those, habits that is probably implicated in the most amount of medical problems. But we do know it's a significant risk factor for a lot of gastrointestinal cancers, stomach, esophageal, pancreatic, plus colon cancer. Some studies have cited a 20 to 30% risk of colorectal cancer if you do smoke. So that's significant. And from what we do know about it, smoking has carcinogens in it. So these can kind of directly damage the DNA of the colon cells. So that can increase risk of polyps and mutations in colorectal cancer. It's tied to gut inflammation. So that certainly also increases turnover of cells and potentially risk of colon cancer. It modulates your immune system, so not just in your lungs, but also in your GI gut health, and your immune system so important in your body's defense mechanism and killing these precancerous or cancerous cells. And then finally, again, we keep on going back to gut health. Tobacco is just, it really is bad for your gut health, and your gut health is your one kind of protective mechanism to prevent a lot of this damage and colorectal cancer. So you really want to nurture it, and tobacco we know is bad, unfortunately.
And Dr. Zhao, when you say smoking, do you mean just cigarettes, or are you also talking about cigars or other
Yeah.
things that people smoke?
Yeah, I mean, I include all tobacco products, quite frankly. So this is, smoking obviously has a lot, and then the inhalation of that also is for the lung, but cigars also can increase risk, and then even chewing tobacco. We do know that is also increase your risk for things like oral cancers. I think for the purpose of colorectal cancer, most studies are really looking at cigarette smoking, but I think tobacco is across the board. All forms of tobacco actually is carcinogenic.
Got it. Just wanted to clarify that, because some people will say, oh, I do one and not the other, when really both increase risk. Yeah. Dr. Malik, what should I do if I have a family history of colorectal cancer? So we talked a little bit about this before, but are there any lifestyle modifications? Can you talk more about the earlier screenings and anything you would let people know about?
Yeah, absolutely. First, it's important to actually confirm the family history, meaning, is it a first degree relative? Is it a parent, a full sibling, a child? And you want to know a little bit about the specifics. What was the age of the diagnosis of the cancer? And was it a confirmed cancer? Was it a precancerous polyp? These are things your doctor is going to want to know. If it is a confirmed cancer in a first degree relatives, then guidelines do recommend that we begin screening at the age of 40 or 10 years prior to the age of diagnosis, whichever is early. Thereafter, guidelines typically say repeat in 5 years, but there's some variability there as to what's seen during the colonoscopy. This population is at a higher risk, so it's especially important to counsel this population on the risk factors that are modifiable, meaning the things that we've talked about already today: the sedentary lifestyle, the healthy diet. It's very, very important that we counsel this population in addition to the other populations, but because they're at a higher risk, it's especially important.
That's so good. Thank you so much. I know that at the Colorectal Cancer Alliance, we have certified navigators who talk to patients and talk to people who are, wanting to get screened every day. And one of the things that we do, especially around holidays, Thanksgiving, Christmas, we try to give people prompts to bring up family history, to say, hey, I remember, grandma died when I was 3, what does she die of? Or to encourage healthy eating habits and exercise habits. A lot of times when families get together, you don't talk about that, but I think it could be a really good time to bring that up.
You're absolutely right, because a lot of times, and I'm sure Dr. Zhao feels the same way, a lot of patients come to me and say, my grandma or my aunt, she had something in her her stomach or intestine. I'm not quite sure. So just clarifying that history is really important for us, because it'll help guide management a little bit for us.
Absolutely. I mean, how many of us were growing up, someone passed away in our families, we thought it was one thing, turned out it was something else, and we don't find that out till later, similar to
Totally.
my friend Shannon. So that, finding out and clarifying is really, really important for sure. So we are at the end of this wonderful webinar on Facebook Live. I wanted to get our doctors' final thoughts before we wrap up. I know this has been such a really great discussion here. And if there are no questions from Facebook, I want to give the 2 doctors an opportunity to just share their final thoughts. So Dr. Zhao, would you like to start?
Yeah, I mean, I think if there's any take home from this is just be aware that, colorectal cancer screening is something that we do, that we recommend. We start at age 45 if you don't have a family history, but talk to your family, right, about your risk factors. Ask around, did your mom or dad have a colonoscopy? Did they have polyps? Grandma have colon cancer? And these are really important in terms of kind of what you can bring to your doctor in terms of when you should start screening or what modality of screening you should be going for. At the end of the day, the best screening test is the test you get. So just know that there are multiple options out there. Colonoscopy is not for everybody. They may not want to do a prep, but guess what? We have a FIT test, which is really easy. You can do it from home, or there's some other modalities that we have also. So just really, it could be tailored to what are your medical problems and who you are. And so just talk to your doctor about screening.
That is so good. I know a lot of times when we think about it from a health equity perspective, there's so many barriers that people have getting into the doctor to even have the discussion. And so we also believe at the Alliance, we know that the gold standard is colonoscopy, but also we know that the best one is the one someone takes. So we are very, very happy you said that. Dr. Malik?
Yeah, I echo so many of the sentiments that you and Dr. Dar are saying. The best test is the one that gets done. But thank you to everyone who tuned in. Honestly, hopefully we were able to give you a little bit insight into this, that it motivates you to get screening, but also you share it with your friends and family and tell them to get screening as well, because that's the point of all of this.
Absolutely. And it can save your life 100% to get screening, or someone else's, which is even more important. Thank you so much, everyone, for joining us in this engaging discussion. If you'd like to know more about this topic or explore other health topics, feel free to visit kp.org/doctor and colorectalcancer.org, which is the Alliance's website. We thank you so very much and have a wonderful rest of your day.